COVID-19's impact on medicine has well been documented, but the importance of telehealth has been augmented during the pandemic. Reporter Brock Turner shares how changing regulations and some local innovation has helped connect service to those who need it the most.
Good morning, Mrs. Fields.
Good morning, Dr. Torrance. How are you today?
It's been a busy couple of months for people like Becky Sanders, the program director for the Upper Midwest Telehealth Resource Center. It's a group that provides resources for providers trying to implement telehealth in their service lines. Sanders says the policy and reimbursement for telehealth has rapidly shifted in recent weeks.
That is changing so rapidly. There at the end of March, beginning of April, it was changing almost on a daily basis. So it's finally starting to solidify and stabilize.
Those shifts have kept patients from traveling to their local doctor's offices. For the first time, Medicare and Medicaid patients can be seen virtually from their homes. Sanders says calls have come from large and small insurance companies and even primary care physicians.
The emails and the phone calls have just gone through the roof. It had been growing steadily over the past several years, but in the month of March, we did more technical assistance than we had the previous 6 months.
One provider that has been forced to dive headfirst into telemedicine is HealthLink. They're a community health center with 14 physical locations across northern Indiana. Beth Warble is the company's CEO and says adoption has had to occur quickly.
This was all things we had on our strategic plan for the next 2 to 3 years, and we did it in 2 weeks.
Telemedicine has helped providers from bleeding even more cash that comes from steep declines in patient visits. HealthLink usually sees about 14,000 patients every month, but only saw 8,000 in April. Warble believes telemedicine, even if it's unable to fully replace in-person care, is here to stay.
If I have to take telehealth away from the patients and our providers, there will be a mutiny, because it really does get people in. And at the same time, right now, especially as we start to open up more visits, people are still afraid to come in.
As patients begin to venture out to their doctor's offices, schools remain closed. One Indiana group that provides telehealth equipment to rural schools is working to redeploy that equipment to healthcare providers. Kathleen Chelminiak is the project director for the Indiana Rural Schools Clinic Network, which operates school-based telehealth services in 16 Indiana counties.
Once COVID-19 hit, we quickly realized that schools were not going to be a place for children to receive care because of the mandated order that schools were to close.
With schools closed, she and her team quickly worked to try and match the equipment with a local need. She says equipment from 15 schools are now being used in local ERs, nursing homes, and doctor's offices.
We've been able to kind of bridge the gap of these rural areas needing a means to do telehealth visits in their practices, and they didn't have equipment otherwise, other than this equipment that has been funded to be in schools.
And that's the kind of collaboration and ingenuity that all believe will help push medicine and the standard of care forward, even in these trying times. For Indiana Newsdesk, I'm Brock Turner.